Hello, we want to welcome everyone for joining us today as we bring you our third and final webinar in our three-part series covering COVID-19 health and safety measures that the Boone County Health Department, District 100 and District 200 are working together to oversee. My name is Jen Jackie, and I will be your facilitator for today's forum. Over the last 2 weeks, we took a deep dive into the COVID-19 health and safety measures in regards to the public schools, as well as answered questions from the public. Today, we will provide any updates that have occurred since the last meeting. And if you would like to view the previous recordings, you can find it on Ford Boone's website at fordboone.org. Today's session is also being recorded and made available on the website. At the end of today's presentation, we will once again open it up to public questions. Questions can be asked during the presentation, and we will then answer them in the Q&A session. Next slide, please. Today's presentation is brought to you in collaboration with the Health Department, Belvedere and North Boone School Districts, and its many partners. Next slide. It is my pleasure to introduce today's presenters, Amanda Mail from the Boone County Health Department, Dr. Dan Weisman from the Belvedere School District, and Dr. Mike Greenlee from North Boone School District. At the end of today's presentation, again, we will open it up for questions. So any questions that you have, please put in the Q&A section. At this time, I will go and turn it over to Amanda.
Great, Jen, thank you so much. And thanks to our Forward Boone partners for assisting us in hosting the series of 3 forums. I'm Amanda Mail with the Boone County Health Department. Just want to circle back to some of the goals that we've had for our parent forums, which is providing accurate and timely information as to the work that the health department does with both of our school districts to implement COVID-19 safety protocols and measures, which include testing and isolation and quarantine and updates to parents, et cetera. We want to give you some progress updates on what we've been working on here at the health department, as well as our district partners who are going to share some updates. Talk a little bit about next steps, take any questions that you might have, and then conclude our 3-part series. All of our parent forums have been recorded and are available for people to view at their convenience after the conclusion of the forums. Next slide. So mentioned already that we're going to provide some updates today, answer those questions and concerns, explain or clarify any challenges that we continue to face with the rollout of our safety precautions in the schools. Receiving constructive input is always helpful. One of the reasons that we put these forums on was from getting some constructive feedback from our parents, and then work with our parents and our community to troubleshoot and problem solve any issues that affect the wider community related to COVID. That's what we've been working on throughout this pandemic, and we'll continue to do so. Next slide. Okay, so just an update from the health department side. We have successfully onboarded 3 new COVID-19 response staffers, which essentially doubles our capacity for our contact tracing activities, which is really exciting. Those new staffers are in their 2nd week here with the department. They're really doing a fabulous job catching on very quick. That will help us, as I've mentioned in previous forums. We do use the Illinois Department of Public Health Surge Center when there are an overload of cases. I know sometimes that is confusing to our local community when they get a call from the Illinois State Surge Center instead of one of our contact tracing team members. Now that we're onboarding new staff, we should be able to make most of those calls or begin to decrease the number of calls that go directly to the Surge Center. So that's exciting news from our end. Also, the metrics both locally and regionally continue to decline in terms of community transmission rates. Rate per 100,000 continues to decline. We're seeing a stabilization in our hospital capacity, which is good. It has not further decreased from when we were surging back about 4 to 6 weeks ago. So those are all positive changes. Many counties have moved out of orange warning status into blue stable status, and I hope that in the next handful of weeks we will see Boone continue to trend in that direction. In terms of guidance changes and updates, last week the state health department did push out some changes in definitions for outbreaks, and continued to provide clarification for the decision tree for exclusion, our sports activities and extracurricular activities, the guidance for bus riding and cafeterias, and all of that information is shared with our schools on a daily basis through informal conversations, Zoom meetings, catch-ups and touch bases and debriefs with specific buildings or groups of school staff when necessary. And then we have formal weekly briefings with all of our school, daycare, and childcare providers on Fridays to provide updates on those new guidance documents. We did get some changes. A lot of it helps us locally to make decisions and further our processes and solidify what we've been doing. So we've been pretty happy with some of the decision or some of the guidance that has been changed because of local health department and local school feedback to the state. So that's a really positive thing. As far as testing updates, we're going to hear from both of our school districts on what they're working on with implementing testing within the buildings and within the districts. I can say that our department continues to conduct site visits on the testing sites that have popped up here in Boone County. We're also working both with SHIELD, and now it sounds like we may have the opportunity to be a pilot county for a new federal testing program that would bring more testing kits and options here for community-based testing sites in Boone County. So I'm working with the state of Illinois to implement that as well. And then as far as our quarantine process and a test to stay update, I would just mention that on Monday, we went live with a change to the 7-day early release quarantine process from what we were previously doing, which was the 10-day early release quarantine process. That's eligible to certain students in certain exposure situations within the schools. We've worked on combining and streamlining the bullet points of information that parents in both districts and parents that receive information from our contact tracing team are getting, so that it's the exact same bullet points and information to avoid confusion. We've also provided that information to the surge center so that when they're working with any of our cases, they're aware of what our processes are. We're a couple days into the 7-day early release process, and I'll let my school partners talk about that if they have any updates, but at least from our end, from my staff's end, that's been running pretty smoothly. It moves us in the right direction to explore the test to stay option when we see the metrics in our community and our region and state further decrease or decline, and when all testing processes are up and running within both of our districts. So everything is moving in a very positive direction from our perspective. We welcome constructive feedback and input from parents and community members. And with that, I'll move to the next slide. Okay, and I'm going to turn it over to Dr. Weisman to give an update from District 100.
Thanks, Amanda. I appreciate that. We continue to appreciate the partnership of the Boone County Health Department. Their office is very helpful for our school officials and nurses who have a lot going on in their schools every day. We were able to, just like Amanda talked about staffing at the health department, we were able to onboard in the last week and a half health assistants at all of our schools to provide support to the school nurses and school administrators and school secretaries in terms of contacting parents and state required paperwork for any quarantines that are happening in the schools. Amanda mentioned the SHIELD testing program. After a school board discussion last week, at our school board meeting, we decided as a district to discontinue the relationship with SHIELD for student testing. So again, SHIELD is the entity that's tasked with internal testing at school districts for students. I think a lot of community members here didn't realize that the partnership with SHIELD would mean that we used SHIELD's data portal for tracking whether or not students had consented. So we did get confirmation from SHIELD that they are willing to remove any data that they had on students because of that request to opt out. You know, our numbers are looking pretty good. I think we've had just in the last week, if I look at our numbers in the last 7 days, we've only had 6. let's see, 9 positive student cases in the last 7 days. And so we feel like we've got some good numbers that are congruent with the community numbers. And we are hoping to start finding out from families if they are interested in receiving any information about vaccines for younger children. We assume as a school district that more information will start coming out about that in the coming months. And for families that are interested in helping them receive that information, we're going to ask families if they would like to receive that information from us, because sometimes it's hard to find out in the interwebs. So families and parents can look for just a request for further information for us so that we can provide that information to you in the coming weeks as it comes out, hopefully. I think that's all the update that I've got. Oh, I would say one other thing. I appreciate we did have some community members answer the call last week for helping with food service and driving buses. But again, if there are any community members that are willing to assist in this, we are experiencing staffing crunches with our food services in the cafeterias, getting breakfast and lunch to kids, and with our bus routes. So far, we're able to run all of our routes, but it's starting to get tight. So any community member that's looking for a fun opportunity to serve and hang out with kids and help out during the pandemic, help their school out, we'd love to hire you. I think that's all I got, and I'll turn it over to Dr. Greenlee.
Thank you, Dan. Thank you, Amanda. Things are going very well up here in North Boone School District. We've had the last couple of weeks have been fantastic. Our metrics have really been trending the right way. Our quarantines have been cut in half the last couple of weeks, and also too, we've seen a real significant decrease in the number of positive cases that have come to the district. So that's gone very, very well, and I'd like to keep that trend moving that way. This week, we also began implementing the 7-day quarantine protocols that are now available to us, which is fantastic. So the more things that we can do to keep kids in school, we will be supporting. So I'm thanking the Boone County Health Department as we continue to move that direction as well. We are continuing down the shield path. We've slowed up just a little bit, only to make sure that the protocols and the processes that we have in place are dead on and completely accurate. And we're hoping to have that running up here probably either at the end of this week or the first part of next week. So we continue to move down that path. But things here in the North Boone School District are going very, very well. Thank you, and I'll turn it back to Amanda at this point.
Great. Thank you, Dr. Weisman and Dr. Greenlee. Jen, I believe we're at the question and answer part of our forum. So I think you might have a few questions that have been posed from community members and folks in the public that we might want to discuss right now. So I'll turn it to you.
Yes, I do. So my first question is for the districts. How have the quarantine numbers changed over the last couple of weeks?
I'll jump in first here. Specifically in Belvedere 100, we have seen a significant decline in the number of students that are quarantined. I think that's probably related to two factors. One is that overall, Amanda mentioned just rates in the community going down, but also this week being able to start bringing students back earlier through that 7-day early return process just generally cuts down by about 1/3 the number of students that are out on any given day. So we've been consistently now for a couple of days under 150 students that are quarantined, which is really good number for us.
Yeah, and for us, the same factors apply for us. The last 2 weeks, we've seen significant declines. And we previously, when things were a little higher in the area, we were running about 120 kids a week being quarantined. The last 2 weeks, we've been down around 60. So we've cut that in half. The other thing that we're seeing is going from 5 positive cases a week. The last 2 weeks, we've had only 1 new case each week. So our trends have been fantastic and going the right way. And let's keep it going that way. Thank you.
Okay, the next question is, are districts requiring students to get the vaccine?
Nope, I don't think we're legally even able to require students to get the vaccine. So in any school district. So we are trying to facilitate the information about vaccines to families. So we'll send out updates about when vaccines are available, especially probably, we did that in the spring when vaccines were newer, and over the summer when there were clinics that the health department and school district sponsored together. Maybe that clinic was at one of our schools, but we've never required and at this point are not allowed to require a vaccine. We will, in Belvedere, will continue to communicate about vaccine availability, especially if the little kiddos are able to get a vaccine here in the coming months, but we won't require that at this point. That would probably be a state level decision if it were to ever happen. There are some immunizations that are required for students to come to school that every year families have to turn in from their physician record of having gotten that. But we don't require the kids to get the flu vaccine. We don't require the kids to get a COVID vaccine. I don't know, Dr. Greeland, if you have anything to add to that.
No, you answered it pretty well. I like when you go first because then you answer it and I can just kind of relax a little bit.
You can go first on any other questions.
No, but I would, I'd say the same thing. I would imagine the guidelines that the state will give us at some point will probably match what we're doing for kids 12 and over. So same thing what Dan said. I don't picture that being a mandated thing, but I picture us following the state guidelines, which my guess would be similar to what they're doing with kids 12 to 18. So.
Okay, and again, just a reminder, this is the Q&A section. So if anybody has any questions, please feel free to put them in the Q&A feature. Also, please remember to be respectful and constructive. The next one kind of is a similar question, but if families choose, once the vaccine is approved for elementary school students, how are schools going to get the vaccine to the students?
Dan, you want me to lead off this time and give you a break?
You got the thumbs up.
Okay, so we've already had initial conversations with the Boone County Health Department in anticipation that this could be coming. So we will be working collaboratively and cooperatively with them to promote opportunities for staff, or not for staff, but for students and parents to be able to do that. And I know we're working on the logistics of buildings, locations, times to try to make that as easy as possible and as pain-free as possible. So we'll work partnership with the Boone County Health Department, similar to what we've done with staff and some of our older students.
Okay, Dr. Weisman, you got?
I think he got it. I think Mike got it all.
Perfect.
So Jen, I would just add from the health department standpoint, we have already pre-ordered some pediatric doses for the 5 to 11 population. It has not been officially approved for emergency use authorization yet, but we anticipate, based on everything we are hearing from the state and federal government, that will happen in the next week to 2 weeks. So we will be ready to go live with information on how parents can sign up to take their child to a pediatric focused clinic. So we're not going to do children mixed in with adults at our current clinics. We're going to have clinics that are designed specifically for children ages 5 to 11 with the proper dosing and nurses who are well trained in working with children. And there will be health department and district staff present to provide support to the families that want their 5 to 11-year-olds vaccinated. And that's coming very, very soon. We are so excited that a lot of our elementary school kids will very possibly be fully vaccinated by Christmas, which is, for me, a great Christmas present. It also allows for elementary school and younger middle school kids to take advantage of some of the opportunities that those 12 to 17-year-olds have, which is when fully vaccinated, there's less exclusion from school, there's less exclusion from sports and extracurricular activities. They have more opportunities to stay in the classroom and interact with their friends when they have that life-saving vaccine in their systems.
All right, great, thank you. Okay, so knock on wood that this doesn't happen, but if there was a surge, how much notice would be given if a school had to be shut down?
I think you're up, Mike.
I'll go first. So the last time that we did things kind of quickly, we had a big surge in our metrics, and I remember speaking with Dan and Amanda as we walked through this, and at that time we were kind of watching that surge occur, really coming from the east, from the Chicago area, and working its way out. And I know that the last time we did it, we really had conversations about it leading up to it, probably 2-3 days in advance. I would imagine that we try to give it as much time as we can so that people are prepped and ready to go. I know here we've talked with our principals about to say, how long would you need if you needed to, if we needed to turn to remote education? And I think that in the North Boone School District, we could do it in as fast as a day. But I think all of our preference would be is if we've got a few days, the more advanced time that we can give it to allow teachers, staff, parents to prep for it, the better off we are. So we could do it quick, but I think allowing people time to be able to plan and be prepared and make sure that our kids are covered, supervised, taken care of, it really becomes a process there to make sure that we've got everything in order and our kids are covered. So I don't know if I missed anything, Dan.
Yeah, I would just say sometimes people forget that, parents forget that one of the reasons we might have to close a classroom or school down is for staffing. Maybe there's not an outbreak, but we're just running low on staffing. In those scenarios, most of the time, I think what Dr. Greenlee said also applies. We can usually give parents, more than a 3-hour notice. We can usually give parents a 24-hour notice if something like that's going to happen. And we'll just squeeze through that day where we might have low staffing.
Okay, so this one's probably for you, Amanda. The big buzz is around booster shots right now. So can you, I know probably, it's not necessarily for the students, but can you kind of give us an update on any booster shots that the families may want, information families may need, or people who are working in the district?
Yeah, definitely. So the FDA and the CDC did finalize their authorization late last week. I think it was Thursday night into Friday morning for booster shots to be available at an expanded capacity. So for the past handful of weeks, we've had the approval to do Pfizer booster shots for individuals who got Pfizer for their first and second dose. And now that has been expanded to Moderna and Johnson & Johnson. So we did release a press release this morning. So this applies to any parents that are listening or any school staff that are interested in getting the booster because they received their first shots of Moderna and or Pfizer 6 months ago or more, and then for the Johnson & Johnson 2 months ago or more, right? And we do have boosters available for all 3 vaccine brands, and those can be mixed. So if I received Moderna for my first and second shot, I could elect to go to a pharmacy and get a Pfizer for my booster dose. It's been approved to do that. And I just also want to clarify too, that many other vaccines that are on the market allow for brand mixing and matching. That is pretty standard operating procedures once there's been enough clinical trials and research done to justify the efficacy. So some of us get Tdap vaccines if we're a parent or grandparent awaiting a new baby, or if we are getting our annual flu shot. Those would be some examples of vaccines where you wouldn't necessarily get the same brand every time you get an annual flu shot or every time you get a Tdap booster. So we are seeing that the efficacy of the COVID-19 vaccine is such that you can mix and match those brands and it still provides the level of protection that we need. So the health department is offering clinics on the next handful of Thursdays, and we did release that information. It's going to be available on the Forward Boone website, on our website, through social media outlets. It's going to be pushed out through both school districts. And then in addition to that, for our school staff, we are going to be hosting a couple of Friday afternoon dates to be determined and released very shortly. Friday afternoon booster walk-in clinics specifically for school staff that would have probably received their first couple of doses back in the early parts of 2021 and are now eligible to receive a booster. So we're working on that, as well as getting ready to implement the 5 to 11 pediatric clinics for COVID-19.
Great. We have one question left. Please feel free, if you do have another question, to enter it into the Q&A feature. But the last question that we have up is regarding a little bit of a shift, but you had just mentioned it, flu shots. So does the health department have flu clinics or any information on the flu shots?
Yep, we actually have a clinic going on right now in our parking lot as we speak. So today's the 26th. We have one more clinic scheduled, which is a drive-through clinic, and then we will be offering some walk-in clinics here in our building, dates to be announced soon. But at this point, we have a couple more dates this week, and then we'll be putting out more information shortly. But yes, we do have flu shots available, and so do all the pharmacies here in the county, as well as most of the primary care providers that people in this community either see here in Boone County or in the greater Rockford area.
Okay, so last call for questions. I'll give it a minute. Okay, it doesn't look like anybody's typing, so I just wanted to say thank you so much. Thank you to our panelists who have done these last 3 very informative sessions with us. Again, this and all of our forums will be are recorded and put on the Forward Boone website. Here is the information for the contacts for the districts and for the health department. And I would just like to say thank you for joining us, and have a safe and healthy day.
Thank you, everyone.